Welcome to today's lecture. We will be diving into fascinating world of kinins, focusing on their biosynthesis, how they are formed in plasma and tissues, and their wide-ranging effects on the body. We will explore their role in the cardiovascular system, endocrine glands, inflammation, and pain. Then we will look at the receptors they act on, their metabolism, and finally the drugs that target the Kallikrein-Kinin system. By the end, you will have a clear understanding of kinins and their importance in physiology and the medicine. So, kinins, such as bradykinin and kallidin, are short peptides with potent biological activity. They are derived from precursors proteins called kininogens, which exist in high and low molecular weight forms. The enzymes responsible for their production are kallikreins, either plasma kallikreins or tissue kallikrein. These enzymes are activated during specific process like coagulation or inflammation. Once active, they cleave kininogens to release active kinins, which then mediate various physiological and pathological effects. In plasma, kinins are primarily formed when the Hagman factor or factor 12 activates pre-kallikrein, converting it into kallikrein. Kallikrein then cleaves high molecular weight kininogen to release the bradykinin. In tissues, kallikrein acts on low molecular weight kininogen to release the kallidin. These reactions occur in various organs like the kidneys, pancreas, and intestines, highlighting the widespread importance of the kinin system. Kinins are involved in many essential processes. In the cardiovascular system, they are strong vasodilators, promoting blood flow and reducing the blood pressure. However, this can lead to excessive capillary leakage, causing edema or even hypotension in certain conditions. In glands, they stimulate secretions like saliva and digestive fluids. Kinins are key players in inflammation, where they cause pain by activating sensory nerves and amplify the inflammatory response by attracting neutrophils and stimulating cytokine release. They also regulate smooth muscle contraction in organs like the bronchi and uterus and obviously maintain the renal filtration. Kinins work through two types of receptors, B2 and B1. The B2 receptor is always present and mediates the acute effects of bradykinin, such as vasodilation and pain. B1 receptors, on the other hand, are upregulated during inflammation and respond to modified kinins. Both receptors are G protein coupled receptors, which triggering intracellular pathways that release calcium and nitric oxide to mediate their effects. Now, kinins are short lived peptides, rapidly degraded by enzymes like ACE or angiotensin converting enzymes, which also regulate the renin-angiotensin system. ACE inhibitors used in hypertension prevent the bradykinin breakdown, which can lead to side effects such as dry cough or angioedema. Other enzymes like carboxypeptidases also help metabolize of kinins, keeping their activity tightly controlled. Now, the drugs which targeting the Kallikrein-Kinin system are used in both hypertension and rare conditions like hereditary angioedema. ACE inhibitors are common but can lead to bradykinin accumulation, causing side effects. Newer drugs like ecallantide and icatiband specifically inhibit kallikrein or block bradykinin receptors, offering targeted treatment options. Now, to wrap up, kinins are small but powerful peptides with diverse roles in the inflammation, pain, and cardiovascular health. They act through B1 and B2 receptors, and their regulation is critical for maintaining balance in the body. Drugs targeting this system have revolutionized treatments for hypertension and hereditary angioedema, highlighting the clinical importance of understanding kinins. Thanks for watching, and I hope this was insightful.